More than 3 years after the World Health Organization declared COVID-19 a global pandemic, we are still discovering new subvariants of the virus, but we're also finding new ways to combat it. Joining me now is Dr. Neha Narula from Stanford Health Care. Thank you so much for joining us this morning.
Thank you for having me.
Now, researchers at Stanford are looking into a low-cost COVID-19 vaccine that could potentially be distributed around the world. Can you tell us a little bit about this?
Yes, absolutely. Dr. Peter Kim and his team have developed a vaccine currently known as the Delta C70 ferritin hexapro that uses protein fragments that will potentially target many strains of the SARS-CoV-2 virus. Additionally, like you mentioned, what's particularly different about this vaccine is that it is low cost, making mass production easier. And it does not require refrigeration. In fact, it can be unrefrigerated for up to 2 weeks. And this tackles the two barriers that have kept most of the unvaccinated world away from our current vaccines, both cost and temperature requirements for the current vaccines that we have in the market. And that's exactly what Dr. Kim's team wanted to do, was to tackle these barriers. So far, this vaccine has been tested in rhesus monkeys. The response has been excellent. They have provided protection for almost 1 year after these vaccines. And so this particularly seems promising for infants, is what they found. We're obviously still waiting for human studies to be conducted with this particular vaccine, but it is a very exciting development with hopes to improve immunity around the world.
And that's really the goal with these vaccines, right? Is that this is something that you're going to get every year, like you do the flu shot. It's just going to be kind of part of that protocol, and that'll be it. You won't have to get necessarily multiple boosters, unless, of course, you're immunocompromised, right?
Sure. Yes, that is the ultimate goal, is that this starts to phase away, but we do know herd immunity is so important, not just within our nation, but throughout the world. The more chances this virus has to mutate, the more variants we're going to see, and it's going to be harder for this particular virus to fizzle out. And so international immunity is just as important.
Right. Now, speaking of those other variants, there's a new COVID variant, as there seems like there is about every 3 months that we're talking about here. But the symptoms to this one are a little bit different. Can you tell us a little bit more about that?
Yes, of course, Liz. So this particular new subvariant is called Arcturus, or also known as XBB 1.16. It was identified in India earlier this year. It has unfortunately spread to about 29 other countries, including here in the US. Now, it is still a part of the Omicron lineage. So these are the particular variants that we've been seeing for the past year. But it does have a mutation that makes it a little bit more transmissible, a little bit more infectious. In particular, we're seeing an uptick in children. But the good news is that it's not causing more severe disease. Now, when it comes to symptoms, we are still seeing things like sore throat, cough, fever. But the new symptom that people are talking about is the symptom of conjunctivitis, or we know this often is called pink eye. And this is happening both in children and adults. Now, this isn't actually particularly new for COVID. We saw this with the original strains. However, we are seeing more of it. With the prior strains, we were seeing more cold, fever, cough, headaches even. Pink eye wasn't as common, but with this particular strain, we are seeing this a little bit more commonly in more patients. Now, given that this is allergy season we're in right now in the Northern Hemisphere, and there are still other common cold viruses like the adenovirus, which is known to cause conjunctivitis, it can be a little bit confusing. So, if you haven't been protected with the vaccines or boosters, go ahead and get those. It's a good time, especially if you're eligible. But if you are having some of these symptoms, watery eyes, red, itchy eyes, or other cold symptoms, especially now with this new subvariant circulating, don't write it off as allergies. Go ahead and take that COVID test and talk to your healthcare provider so we can give you some further guidance in terms of treatment.
Yeah, Dr. Narula, that's a great advice. One more question, though. I wanted to ask about that second bivalent booster for some Americans. Can you tell us a little bit about how that works and who's eligible?
Yes, absolutely. So as of last week, Liz, both the FDA and the CDC gave the green light for anyone over the age of 65 to go ahead and get their second bivalent booster. Now, this can be done about 4 months after your initial bivalent shot. And these are the same shots that were introduced last fall. They have the mRNA technology for the original strain, as well as the new Omicron strains that we saw earlier last year in 2022. Additionally, immunocompromised people under 65 can also get their second bivalent boosters, and this can be done as early as 2 months after their initial shot.
Okay.
Now, for the majority of the population that are healthy, immunocompetent, we're, like you mentioned, looking more at annual boosters. Of course, if this changes, we'll update our viewers. But right now, we're looking at potentially a new booster this fall or winter for the healthy population. So if you are eligible, go ahead and get your second booster at your local pharmacy or immunization center.
All right, Dr. Narula from Stanford Health Care, thank you so much for this amazing information.
Thank you for having me.
Well, coming up